Aloha Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Boy, are we back again? Yep. Boy, that week goes by pretty quickly, doesn't it? And the older you get to see, the quicker they fly by. It seems like just yesterday we were sitting here talking to Dr. Juliff, and here we go again. And, you know, every single day, every single program, we try to highlight all kinds of different areas of venous surgery. That's what Doc does. Some of the things in the offices, I'm going to point you to this, in the clinics on the Big Island in Maui and Kauai and here on Oahu, are fun. There's some things that are just to feel good and raise your self-esteem. Some really, really cool things that are going on. But today, we're going to talk again about venous disease. And, you know, I thought going into this, first of all, Doc, I thought to myself, it seems to me that the real serious part of venous stuff, you don't see. You know, as quickly as you see little spider veins and maybe even some varicose veins, and you think, well, if I just get those taken care of, I'll be okay. I'm not talking about some of the other stuff like ulcers and all that stuff. That's really somewhere down the road. But is that true that the very easiest to control is right there on the top? It doesn't mean that there's something bad going on, but not everything is what it seems. You got a leg there. Who knows what's going on in there?
Right. Who knows what's going on? And you can't just deal with the superficial stuff because, you know, the superficial stuff usually has a deeper underlying cause for it. But one of the struggles that we have all the time is trying to educate people about the myriad of symptoms that can be associated with vein disease, and they really are a huge spectrum of different types of symptoms that most people don't necessarily attach to venous disease.
Yeah, and by the way, some of the things we're going to differentiate between on this program, and this is why there are so many different fields of medicine that are specialists now. And, for instance, many of you know that there are diabetes doctors that they specialize in diabetes. There's a great deal of communication between diabetes doctors and venous surgeons because a lot of times the most obvious signs of diabetes problems are the legs and the feet.
They can be.
Yeah,
they can be.
Especially in Hawaii when you see this stuff all the time. So let's talk about that a little bit from the standpoint of, if somebody initially comes in just because they want to go to the beach and they don't want people looking at those little things on their legs, but they're also worried that, it hasn't really hurt me. I mean, I don't like the way it looks, but I'm scared that if I start doing this, we're going to find out worse stuff.
Right. Worse stuff, yeah, but, we try to, again, further educate the patient, because, we might be finding some underlying problems with vein function, but it's important that we stop that process and we start to get on the path of, healing what is wrong with the patient. With respect to the patient actually being able to identify signs and symptoms of a potential problem of underlying venous insufficiency. Like we said, there's a whole myriad of symptoms out there, and unfortunately, sometimes it's hard to know whether it is or not. But varicose veins and spider veins, they're pretty easy. I mean, most everybody knows that, I've got a bunch of varicose veins. I must have a vein problem. Now, by the same token, those people identify varicose veins as being abnormal, but many people think that the varicose vein is the problem.
Of course.
Get rid of the varicose vein.
Get rid of it, yeah.
But, the varicose veins and spider veins sometimes are basically just a sign of an underlying problem with vein function that's a little more complicated than most people think. But at least varicose veins gets the patient into, they can make the connection. That gets the patient into, the doctor's office for it to be evaluated.
Therefore, I think it's a good idea. And one of the things that Doc and I talked about off the air before we started to record this program was because the topic that he sent me was going to be inconspicuous symptoms of venous disease. And I'm thinking to myself, all right, some you can see, some you can't. But it just made me think of pain and swelling because I've done those things, and many of you listening have that as a problem. that I know nobody wants to wish pain upon somebody, but I'm almost hoping that some of our listeners get itchy or get sore or get swollen or get painful so they can realize that they might have something going on in there. Because otherwise, how do you find out?
Yeah. Well, or at least recognize the symptoms that they're having for what they are, because, like we've talked about in the past, the symptoms come on so slowly and over such a long period of time that it's very easy for people to get used to those symptoms.
This is just me. I'm just aging a little bit. I'm just getting this normal.
Yeah, and we hear that all the time. People have a little bit of. They have leg complaints. They come in and we fix them, and afterward, that's what they say. They say, "Doc, I didn't know really how bad my legs felt because now they feel great." And there's a lot of things that can be chalked up to age.
Yeah, and there is, and by the way, and there's also a lot of things that get, as you've learned listening to the program, that get charged off to genetics. I mean, a lot of us out there, you all and me. It's a parting gift from your ancestors that you get these things. But I'm still going to go back on what I'm thinking is important, and that is knowing in this day and age, everybody says, "Gee, my leg feels flippy. I'm going to go look on the internet. I'm going to go find out what's wrong with me."
Yeah,
a lot of people are doing that, and I guess it's okay in some respects because it gets you thinking.
Right.
But you can't just say, "Well, I'll just take some more of these lemon drops. I'll be okay."
Yeah.
Because that's what it said on TV. I mean, that's what it said on my internet.
You have to be careful about what you read on the internet. Yeah, There's no question about that. But actually, I do like it when people have come in and have said, "Oh yeah, I Googled varicose veins," or "I've been studying this or that," because at least that gives them some additional insight into then what we're going to be telling them, and hopefully we'll be kind of honing in on the amount of information that they really should be focused on, in a first step to recovery of what their problem is.
I guess that some of the things we're going to do in this program, folks, is differentiate between the number of symptoms or the conditions that lead you to think that you might have venous disease or that you might want to see a specialist. And I'm certain that sometimes, and I mentioned not dermatologists a while ago, but diabetic doctors a while ago, but also dermatologists, because a lot of things that go on with the legs doesn't necessarily mean venous problems. It might be a rash, but also what you think is a rash may not be a rash. It might be a venous problem.
Yeah. There's a fair amount of overlap with dermatology. When we're talking about the skin of the lower leg, especially because, it could be just eczema or whatever sort of dermatologic problem, but it also could be a sign. And a serious sign, because when we start to have skin changes due to venous insufficiency, that means it's been there for quite a while.
Yeah, and by the way, this is what we're going to try to do on this program, is to walk you through some of the maybe I should do this or maybe I should do that based on a sign. Now, one thing that I've heard you ask before, and I've been curious about it, and I know people ask the same question, is that sometimes venous insufficiency can be easier to diagnose if one leg is worse than the other. Sometimes you say, if you have a problem that affects everything, it may not be a venous problem. It may be something else.
Right, yeah. And swelling is one of those symptoms. It's swelling is one of those symptoms that people don't necessarily directly attach to vein problems, because everybody's got this idea of, oh, gee, I don't have varicose veins. I don't have a vein problem. When in point of fact, you might have, it's just that your venous insufficiency isn't being displayed as varicose vein.
It's not out there.
It's being shown to you. These are your leg signs to you that something bad is going on, and swelling. But you're right. Typically, if we see swelling in both legs, then an equal amount of swelling in both legs, then sometimes it might be due to another organ system. For instance, your heart. The heart has the functional capabilities of the heart. In people who have had a number of heart attacks, if they've had a history of what we call congestive heart failure. Swelling of the legs is one of the symptoms.
Well, you know what? We pointed out many, many times that this wonderful pump called the heart is putting a tremendous amount of blood through your arteries, and it's going right down into your legs. Well, now, if you've got venous insufficiency, it can't come back up. But also, I never really thought about this until you said it. If you have a heart condition, it might mean that your heart's not strong enough to put that blood where it needs to go, that it may not get all the way down to the bottom.
Well, it actually it has more to do with blood getting back up, but actually sort of a backward pressure on the venous system that originates from the heart, not from the veins in the legs. So it's still a problem of upward flow of blood and fluid. But still, people with heart disease might have a fair amount of swelling and have perfectly normally functioning veins, But kidney function is another thing that can create swelling. Electrolyte imbalance, hormonal problems. There's a number of general medical problems that might cause swelling. Yeah. However, most people know they have those things. Okay. If you know that, gee, my heart, as far as I know, is functioning properly, I don't have any kidney problems, and my doctor hasn't told me that I've got electrolyte issues or whatever, then you should be looking for another reason for that. And one of the big reasons for swelling of the legs can be venous insufficiency. We see patients presenting to our office with swelling as their primary complaint all the time, and then we have to sort through whether it's due to vein issues or not.
How, somebody asked me a couple of programs ago that, we're talking about the venous system, we're talking about the veins and the arteries, but let's talk about what's in there. Let's talk about the blood, because you might have a great venous system and you might have something wrong with your blood, and it's getting up and down the way it's supposed to, but you're not well, and let's talk, to me, that's interesting, is that these arteries and these veins are vessels for the blood, but they don't work on the blood. They just transport it. Yeah. Yeah, exactly. So when you talked about the swelling part, and it could be a heart, what did you mean? So, I mean, I don't want people that are listening to radio right now, oh, my legs are swollen, I must be having a heart problem. There are a lot of things that can make your legs swollen, right? Sure. Yeah.
Well, and the point there is that, people who have, major heart issues that are dramatic enough to cause swelling of the lower leg, typically they know they have a heart problem because they've had heart attacks in the past. Many of those people have been treated for, this thing that is called congestive heart failure. So usually it's not a mystery. So the point for those people that know they don't have those other medical problems, if they have swelling in their legs, then it may very well be due to a venous issue, and so they need to look into that.
Yeah. What about people that are both? What are people that they know they have an heart issue, but they don't know they have a vein issue? Yeah, because they've been taking all of these symptoms and writing them off to that's my heart. In actual fact, isn't there a pretty long laundry list of symptoms that you have to parse through to find out how to best diagnose a person's condition?
Sure. Yeah. And it often takes several medical subspecialties to evaluate a patient, and not only to figure out what they have, but what they don't have. Yeah. A big part of our job, if people come in with complaints about their legs, and people come in all the time with complaints of the legs that have to do with a number of different problems. And we've got to sort through all that. Sometimes it has nothing to do with their vein function. Sometimes it has to do with, vein function and also lymphedema, or vein function and some sort of musculoskeletal or nerve sort of problem.
Do you find, Doc, that a lot of people are they're awash in worry because they know there's all kinds of things going wrong because of the symptoms, and they fear the worst? And so they get afraid to even go look because they don't really want to know. They're not really in bed, but they're not feeling so good. But they think, well, maybe if I just cruise today, I'll feel a little bit better. Yeah. Talk about the relief factor when somebody comes in, gets diagnosed, gets a procedure, and say, I can't believe it. My legs don't hurt.
Yeah. Well, I think that's what probably most people need to think about, and that is that don't be intimidated by what might happen. Confront their symptoms, figure out what's going on, and often it's a much easier fix than what they thought it was going to be.
Yeah, and that's the good news. So let's talk about some of those things that patients may not automatically connect to venous situations. I saw that in my notes, and I think that's great because you don't want to think somebody, I got hiccups, I got bad veins. I know it's not anything that ridiculous, but there are some people that make an assumption, right?
Sure. Yeah. Well, they assume that they don't have a vein issue.
Yeah, exactly.
But and swelling is one of them. Now, another several symptoms that people don't necessarily attribute to vein disease because they've just never heard of it before is just chronic achiness. Mm-hmm. Heaviness, right, and fatigue of the leg, and these are very, very common symptoms of venous insufficiency. As a matter of fact, those three, achiness, heaviness, and fatigue, are probably the most reliable symptoms that somebody has venous insufficiency. And again, they may not have varicose veins, they may not have swelling, they may have legs that look perfectly normal. Mm-hmm. But if you have chronic heaviness and fatigue and achiness in your legs, then there probably is a reason why. It's not just because you're getting old.
I was just thinking something. I know it may sound a little ridiculous, but remember, gang, there's no such thing as a dumb question. If you want to have something addressed on the program, it's pretty easy. You go to veinclinicsofhawaii.com and just click a contact us. Or can you tell a doc to talk about this on the radio show? Because what I'm thinking is, and this is not just my thinking, but many others, that when you put up with little things over a long period of time and write them off, like I want to skip backwards. Several programs ago, we were talking about the discoloration on the bottom of your legs when the skin starts to get kind of leathery. And how many people think, well, it's because I'm always doing yard work. I'm okay. That's sunburn.
Yeah, almost everybody. Yeah. Almost everybody has an excuse or a reason why their legs might look like that. Yeah. And again, part of it is that they have no idea that it could be connected to some other vascular kind of problem. And that's where it falls in our lap to educate people, and that's part of the reason why we're talking about it on the radio. But yeah, so achy, heavy fatigue are very, very common. They're very consistent symptoms of chronic venous insufficiency. But again, they come on over a very long period of time, very slowly, so it's easy for people to ignore it. But these kind of symptoms in women, obviously, after pregnancies, that's the period of time where women might start to develop symptoms. And, it's that time period that they have to be aware of those kind of things that might be telling them something about their vein function.
Yeah, we actually touched upon that many programs ago. And I was asking, that sometimes there might be sometimes that having procedures done would not be a good idea if you didn't think there were threatening ones. For instance, you explained once how come sometimes the circulatory system or the venous system gets kind of jammed up during pregnancy because of the amount of mass that goes on in a woman in her torso, and maybe some of this leg pain and this soreness can be attributable to pregnancy, but some of it is a vein issue.
It is,
and it really gets. It gets pointed out when you have all that pressure on them.
Right. Yeah. There's pressure in the pelvis. There's additional pressure in the pelvis as the uterus gets large. When women are pregnant, they actually develop more blood volume. Mm-hmm. So there's more blood going through the blood vessels.
You're eating for two, right? You're providing blood for two, right?
Yeah, exactly. Mm-hmm. And then just the hormonal milieu of being pregnant causes veins to dilate and can lead to further problems in the future. But that's another time period that women in particular need to be aware of. That am I not getting rid of these symptoms even though I've given birth?
Are there times that you would actually want to delay venous surgery until after the baby's born?
All the time.
Yeah, that's
we don't do any procedures on pregnant women. However, the question that we get all the time is, gee, I might have another child, even though I have all these varicose veins and problems and symptoms. Should I wait till I have another child, or should I take care of it now? And the answer to that is no. You should probably have it taken care of now. Yeah. Because number one, it's only going to get worse. Number two, you have the additional risk of being pregnant and having huge varicose veins and possibly developing blood clots and all that sort of thing. So,
Would there be some exceptions, Dr. Juliff, when somebody might have a condition or a bit of trauma or something that would require treatment even though she's pregnant? You know,
I've never seen that scenario.
Yeah.
No.
Okay, let's go. Maybe it's because in the back of my mind I see this thing I see on TV all the time, the PAD or the blood clot when you're traveling, and I do know that pregnant women aren't traveling a bunch either, and for that very reason, right? They just don't want to take a chance on their pregnancy.
If a pregnant woman develops a blood clot, that needs to be treated, definitely. But if they also have venous insufficiency at that point, it's not like we're going to recommend that we do, interventional kind of procedures on a pregnant woman. It's it's not worth the risk. Even though the risk would be pretty low, it's just not worth any risk whatsoever.
What about after pregnancy? I mean, you said before, let's say if somebody says, okay, I think I am going to have another baby, but I don't know exactly when, and it's a couple of years, and some of this is cosmetic. I want to fix it anyway.
Sure. Oh yeah. And that would be, the time to go ahead and fix it. Yeah. There's no real, major benefit from, continuing to have symptoms and, again, the risk of having venous insufficiency and especially varicose veins, just in the event that you might have another pregnancy at some point in the not too distant future. So anyway, so another symptom that people, don't connect at all with venous insufficiency is muscle cramping. Charlie horse, kind of thing.
Especially at night, huh? At nighttime, sure.
Yeah. And we see this all the time, especially in the more elderly population of patients that we're treating. Their quality of life can actually be diminished substantially because of the fact that 2-3 times a night they're having terrible muscle cramping that wakes them up.
And by the way, I want you to know that if you're like that, you ought to really make an appointment, go to Vein Clinics of Hawaii and check it out. I want to make sure that people understand what the correlation is. It doesn't mean all the time that leg cramps are due to venous insufficiency, but if you're waking up on a regular basis, and from what I understand, and I've had a couple of things, a couple of times, but from what I understand, it can be extremely painful, where you can't move. You can't move to fix it. You can't move to pull your toes or push your toes. Right. You're just in pain.
Yeah. And that can go on for a while.
Yeah.
And finally, I think people try to stretch their muscles and get to the point where maybe they can get out of bed and actually start walking around. Or, walk to the kitchen and have a nice big tablespoon of mustard the way we've talked about before.
I was going to say, I think the guy that invented French's mustard came up with that one. But seriously, I think that, that is very alarming to people. And I know sometimes that they'll actually tell a spouse. This one lady told me, I remember I was doing this a long time ago, and said, no, we actually had to call the paramedics one time for him. He was in so much pain, we just couldn't fix it.
Yeah. It can get that bad. Yeah. But at the very least, it can be terribly disruptive, and impact their quality of life. But I think you made a good point before. Yes, not 100% of cramping is not due to venous insufficiency. There are other causes, and typically it's dehydration. We rec people who do come in with cramping as a complaint. We recommend make sure that you maintain good hydration. Sometimes we supplement them with magnesium.
Sure. Sometimes but there's another thing, I think people would love to know. You talked before about it. We've talked about this many times. Electrolyte. When somebody has an electrolyte imbalance, what's that all about?
Well, there's a number of disease processes that can lead to alteration of the electrolyte balance that we might have in our blood. But again, that's one of those things also that people in general should know about, if they have something that's really significant, aside from just, being dehydrated or overusing diuretic medications, that kind of thing.
But what about this? I mean, we talk about these various symptoms and this electrolyte imbalance. Unless you suspected it, is that something that would only turn up like in a blood test? I mean, if you're looking for certain things, I know that I go annually, I have a blood work just to make sure that my nutrient levels are what they're supposed to be. Does that come into play sometimes in your practice where you need, you need to see somebody's blood work.
Yeah, sometimes we do, sure. But yeah, you're right. The only way to figure out whether somebody would have an electrolyte imbalance would be to do blood work. Yeah.
In the meantime, we've talked, gang, and I didn't mean to interrupt the doctor, but we've talked that what we're doing here with the circulatory system, there are vessels that deliver the blood no matter which track it's taking, but they don't change the blood. I mean, the artery or the veins don't do anything to change the blood, but can't sometimes the blood change the arteries or veins because of what's in it?
Yes.
Something that might be irritating or something.
Well, actually, that's very correct. Yeah, but especially the arteries. I mean, for instance, we talk about people with high cholesterol. That
plaque on the arteries, all that.
Yeah, that leads to plaque formation and problems with those plaques. Not so much for the veins. I mean, the venous disease really is more of a mechanical problem. And typically diet and all those sorts of things are not going to impact it tremendously. But yeah, with respect to muscle cramping, some of our happiest patients are those that after we treat them come back and
bonus,
they say,
I got rid of my cramps.
I haven't had a cramp, one time since then. And, they can get back to sleeping through the night completely,
Yeah, and what a concept.
Yeah.
You hear the TV ad. Do you wake up and go to the bathroom all night? No, because my legs are too sore. I probably would if I could get out of bed. But, not wanting to make light of this, isn't it important for people to sort of say, look, okay, I heard the program. I know about my auntie. I know about myself. I'm going to start listing the things that I've experienced, because when we get to the doctor, how are you feeling? Oh, I'm fine. No, you're not, because you're at the doctor. Yeah. You need to bring to the party what's going on with you, don't you?
Yeah. You have to be honest with yourself and be able to identify symptoms. And it's the classic picture there or scenario is that the older couple comes in and we're asking maybe the man who's the patient, hey, do you have this? Do you have that? And the every answer is no. Yeah. And then the wife says, no, that's not right. Don't you remember when you were talking about this the other day? So it's good to have a spouse that's going to remind them of their symptoms.
Yeah, and you also don't want to be considered or accused of being hypochondriac. Oh yeah, I got this, I got that. But somewhere in the middle is what it is. I think that almost all of us want to self-medicate and self-diagnose some things. If it hurts when you do this, don't do this anymore.
Well, and also we, the media in this country has kind of pounded into everybody's head, healthy living. You got to be healthy. You got to do this, and you got to take this, and you got to worry about that. I think that that sort of, peer pressure maybe on people.
Sure.
They don't want to admit to themselves that, gee, maybe I do have a problem, and maybe I do have a health issue, and maybe these symptoms having to do with my legs are due to a medical issue. That kind of keeps them away from being evaluated and keeps them apart from getting better.
I was looking at a number of statistics the other day about nicotine and tobacco use. And I do know that sometimes in the course of examination, that if you are a diabetic or a heavy smoker and other things, that you can contribute to the worsening of a condition. Why is that?
Well, I think that's probably just because of the the contaminants that you're absorbing into your bloodstream. There's no question that cigarette smoking is a risk factor for
certainly for the heart, right, and the lungs,
for heart disease, definitely lung disease, but arterial disease. Not so much for veins, but we've known about that connection for a long, long time. I don't know. Luckily, it seems like the frequency of smoking is kind of going down in this country.
Well, I think that it was, when I was a smoker many, many years ago, and when I was a kid, especially my grandparents, all the old folks, they all smoked. And now none of them do because they're still alive. Yeah. But I think we're down to, it used to be, I think 35% of Americans smoked at one time. And I think it's now down to around 15, between 13 and 15%. So I think death has claimed a lot of people and common sense has taken over in some respects. But that being said, Is that part of the workup? Don't you need to know what somebody does?
Oh, yeah.
I mean, if you ask, do you consume alcohol? 1, 2, or 3 drinks a day. Well, maybe I don't want you to know that, but isn't it sort of important in the big picture to know these things?
Sure. Yeah. And that's the other thing. You have to be kind of honest with your lifestyle, the components of your lifestyle and your past medical history and all that sort of thing, because all of that does help, the practitioner kind of put it all into a nice little bundle and try to figure out what's going on.
Yeah, and what's going on sometimes is not too much fun. But, the other side of things is it must be also gratifying when you go through the examination process of a new patient to start eliminating some of the symptoms because they're not venous. But every now and again, would there be maybe a time where you say, you might have this might be arthritis or this might be something. So you need to, in addition to see us, you need to see your PCP or you need to see a rheumatologist.
Yeah. We do that all the time because you're right, especially with respect to the legs, joint problems, musculoskeletal things, immunologic problems, connective tissue diseases, and then things like plantar fasciitis, that kind of thing. It all gets kind of confused, those symptoms, and you kind of have to weed through them all and try to figure out which is what.
So that's why sometimes by the time you get to those questions sometimes, and by the way, at Dr. Juliff's office, it's a lot better. It used to be, they hand you a clipboard and a couple of pens because there's going to be a lot of writing you're going to do.
Yeah.
And it is so, but you've narrowed that down to the point where you just get a few basic things, and based on your experience and the experience of your staff, you can pretty much tell right away what the next step for this particular patient is.
Oh, yeah.
But talk some more about the symptoms.
Yeah. So, another symptom that we see very commonly that, again, I mean, people just do not connect with venous insufficiency in any way, shape, or form. And again, just because they haven't heard it before, is something called restless leg syndrome. Mm-hmm. And, on top of the fact that people don't know that it's associated with venous disease, a lot of people don't know exactly what it is. I mean, you hear people talk about restless leg syndrome in a variety of different ways. But, the basic thing there is that it is not a nervous twitch leg. Some people have that kind of thing going on, but that's not really what we're talking about. Restless leg syndrome is, a patient has symptoms in their legs, achiness, whatever, pain. And if they move their legs or move their feet, and basically what they're doing is they're contracting the muscles in their legs. Yeah. And when they contract the muscles, that facilitates flow through veins.
Which is a good thing.
Which is a good thing. And at least for a short period of time, it's alleviating that pooling of blood that occurs in venous insufficiency in the lower leg. A lot of it's sort of an uncomfortable feeling that people will have when they're just sitting. A lot of people talk about burning, itching, aching, crawly, tingling kind of sensations. And
the one that always gets me, I'm glad you said that, and I like this because another friend asked me about this after listening to one of our shows too. And this is when you sit down in a long place or whether you cross your legs and when you get up and your leg is, quote, asleep.
Yeah.
I mean, what is that? What's happening there? What is it? Is it circulation related? Why is this leg all of a sudden almost sort of stand on?
Yeah.
And why is it either very, very tingling or almost numb?
I think most of the time, depending on what kind of position you're in, it's either vascular or nerve. Yeah. And I think most of the time it's probably because the way you're sitting is sort of impinging on a sensory nerve. And, that nerve goes to sleep, basically. Yeah. And, it takes a little while for it to wake up and you have all those, nerve kind of symptoms.
So this guy told me, he says, listen, I have this upset stomach and it was so bad. That I'm sitting on the toilet for like 20 minutes, and I got up and my legs were gone. And it may seem pretty interesting, but I guess if this happens on a random basis, you can sort of laugh it off and say that was dumb. But if it happens a lot, your body's trying to tell you something.
Yeah, you need to look into it. Yeah, sure. So
restless leg syndrome.
Yeah, restless leg. And typically, the symptoms of restless leg syndrome seem to worsen in the evening, in the evening hours. Now, probably that's, we see that probably because that's when people are using their legs the least. All day long they're running around and muscles are contracting, and they don't have a chance to get or develop the scenario where you're going to feel like you have restless legs. But especially at night. Especially upon going to bed, and that's sort of the classic scenario where somebody goes to bed and they just can't. They keep moving their legs because they just can't seem to get their legs into a comfortable position, and even to the extent where the symptoms or the involuntary movements of the legs will actually awaken them from sleep at night.
Yeah. So, what leads to that is if you have sleep apnea and restless leg syndrome and a spouse that gets angry at you, this is a real problem. And you may think it is no big deal, but it is kind of a big deal.
It is a big deal because it's like muscle cramping. Because if your sleep patterns are disrupted to some extent, it's going to impact your quality of life. You're going to feel terrible the next day and all that sort of thing. But in restless leg syndrome is something that we see in about 2 to 3% of the general population. Now
so that's not a lot, but when you have a big general population, it is.
Yeah, exactly. I mean, that's a low number, but that kind of indicates a big population of people out there. And restless leg syndrome is similar to muscle cramping in that, not all restless leg is caused by venous insufficiency. Sometimes it happens in people who do not have venous insufficiency.
I was going to ask you that because you do see it with people with venous insufficiencies. You also see it with people that don't. What about people it bothers them so much they don't want to go to bed? Because one guy said his wife, it's like she's running in bed.
Yeah.
He just can't sleep. He has to go sit somewhere else. He can't sleep.
Yeah. Well, we had a patient not too long ago. It was a lady who had tremendous restless leg syndrome. And she said that, in the evening when, the husband and the family is sitting around watching TV, she can't even sit down and watch TV. She's got to be doing something. So, she brings some housework or whatever into the general area where people are so that she can remain on her feet and moving around so that she doesn't have, those symptoms come on when she does finally sit down. So, somebody like that, there's no question that their sleep is going to be disrupted.
Yeah, and by the way, that's, sleep is an important thing. And we talk about quality of life issues here, and the really good news at the end of the tunnel, if you're having some of these venous conditions that we talk about on the program, you need to go to veinclinicsofhawaii.com and click through some of the options and listen to some of the recordings and see some of the testimonials and say, there are so many people. First of all, don't a lot of people think, I don't want to talk about this because I don't know anybody that has. I think it's just me. It's not just me.
No,
I mean, it's like 30% of us have issues here.
Right. Yeah. Probably 30% or a little more of the adult population of this country has venous insufficiency, and it's being displayed symptomatically in one way or another. It's just recognizing it. About a third to a half of people with restless leg syndrome, in a third to a half, it's due to venous insufficiency. Okay. So, half of them don't. There's other reasons.
Should you have expectations of having that decrease after treatment?
Well, we have to explain that to patients. And basically, I just tell them that, there's a good percentage of patients that will be relieved of that symptom of restless leg syndrome. But there's also about half or a little more that where the venous insufficiency the restless leg is due to something other than venous insufficiency. And, in that case, if we fix their veins, it may not have an impact on it. But some of the other things that...
well, one of the things that... Let me interrupt for 1 second and make sure that people understand this. Sometimes people will look at this, whether they want to call it restless syndrome or not, that they need sleep aids, that, they have conditions or symptoms that make it where they are running in bed, or where a guy tells his wife or a wife tells his husband, take, you got to go to sleep. You're not sleeping. You're keeping me up. Once you start relying on things like, medication and things, isn't that like worse?
Yeah, that would be detrimental.
Yeah,
sure,
yeah.
There's no question about it. So, some of the other things that might cause restless leg syndrome are things like Parkinson's disease and a variety of other neurologic kind of disorders. There are drugs that might bring it on. Alcohol, caffeine can cause it. Lung disease, fibromyalgia. There's a number of different things.
I gotta laugh. I had rest his soul and God bless him, may he rest in peace, a stepdad who drank coffee all the time just before he went to bed. Yeah, I'm gonna have a cup of coffee and then go to bed. Yeah, I mean, I'm thinking, what are you doing? And
it didn't seem to bother him.
Well, that's what he thought. But I mean, you could hear the guy snoring a block away. So yeah. I mean, aren't a lot of these things little indicators? Certainly you shouldn't have a big jolt of coffee before you go to bed. But that you shouldn't probably have a big jolt of anything before you go to bed.
Yeah, probably not.
Yeah.
No.
So in any case, let's talk about what happens when you explain to somebody that they most certainly will feel some sort of relief. Because if they got a venous condition that you treat, and that condition is no longer affecting that particular part of the leg, you got to feel better.
Yeah, well, most people are not going to have an isolated symptom like restless leg syndrome.
Oh, okay, more things too.
Yeah. And have venous insufficiency. Usually there's a number of different symptoms. So, we may be treating their achiness, heaviness, fatigue, swelling, those types of things. But as part of their overall picture, they also have restless leg syndrome, and maybe some of their or most of their other symptoms might be relieved, but their restless leg may not, or partially relieved. We see that too. We see not uncommonly. We see people who say, "Oh yeah, well my restless leg is a lot better, but I still have a little bit," and we just have to kind of work with them and try to optimize their symptom.
What you're going to do is you're going to go to veinclinicsofhawaii.com and check it out, and there's a contact us button. And you can put anything you want in there, something you want to hear on the radio program maybe, or something that you want. You will get a response. And that's one thing that the website, it's a great website. And I know, Dr. Jewell, if you spend a lot of time and energy putting your practice on that site so people can sort of get an idea of some of the other things. And like we talk about, some of the cosmetics and some of the fun stuff is there for people to look at. But the actual patient load is basically a group of people that are experiencing the very symptoms that we're talking about today, and really want to be able to pin it on something. Because aren't we all just looking for an explanation? Why does this go bumping? Ouch.
Sure.
What are we going to do about it?
Yeah. And again, that's why we're talking about these items today, because it's not always obvious. It's not always obvious, and we have to educate people to sort of make the connection. Another another symptom that actually can be fairly common, but is not necessarily connected with venous insufficiency, is dry, scaly skin of the lower leg. And this is a fairly common symptom of particularly long-standing venous insufficiency. It often can look like a rash, and we've talked about interconnection
and we've
with
had patients talking about that. That happens a lot.
Yeah. And, there's something that we refer to as venous eczema, or the other term is stasis dermatitis. So, eczema and dermatitis both sound very, very much like a dermatologic problem.
I was going to say, we pointed this out before, but I want Dr. Jewell to re-explain it to you. A lot of times, we've had a couple of patients that have been in here, and they were being treated by either a dermatologist or a doctor with lots and lots of ointment, usually antibacterial, ointment or something, and over and over again for long periods of time. And it really wasn't that to begin with.
Right.
And I do know that I'm sure any doctor would feel, oh my goodness, that's terrible. But now aren't more and more people realizing that if something doesn't get cured within a few weeks or a month, then this is not, we can't just continue this and think it's going to change.
Don't keep doing it. Yeah. And especially in this situation where somebody has a rashy kind of change to the skin, of the lower leg that is very likely due to venous insufficiency. Often they'll be put on either steroids, even orally, or a steroid cream. And the steroid cream can actually, over a long period of time, be detrimental to them.
Isn't that unbelievable? Yeah. I mean, it's in a package and it's from the doctor, and you think, I hear this a lot too, and I'm sure this comes up an awful lot. There are like so many products out there, moisturizers and creams and lotions and ointment. I'm not talking about medicines now. I'm just talking about other stuff. Does it help, for instance, to keep your especially your legs, your lower legs, with some sort of moisturizer?
Yeah. That's okay. Hypoallergenic kind of high quality.
Yeah. Is it going to decrease?
It's not going to fix the problem.
That's what I'm getting at.
Yeah,
it might make you feel a little smoother in that now, but don't expect it to be a cure.
Yeah, it's going to probably make the skin a little less dry, a little less scaly, and it may even make it a little less itchy and a little more comfortable for the patient. And that's why typically I will recommend that people do that, but not with the intent of curing it with that. That's something that we treat from a symptomatic standpoint, and then at the same time we're trying to figure out why this patient has it, and then doing something about it.
I saw something the other day, cracked me up. It was in a magazine, and they were talking about this facial cream, and it was a little thing about it was $90 for this little thing of it, and I'm thinking, all right, what about just the plain old Lubriderm or whatever, $50 a gallon is what it costs,
Yeah.
But don't some of those moisturizers just kind of do the trick a little bit?
They do. They do. Yeah, I don't know if it's worth $100, but it's got to be special cream. But yeah, they do. They can make the skin a little more healthy and probably a little less symptomatic, and for that's worth it. It's worth it.
There's a lot of people that also, another symptom that we've talked about in the past is tightness of the skin. And that not just swollen, but I mean really feeling like it's too tight.
Yeah,
my skin's tight.
The skin is tight.
And want to slather the lotion all over it. Think that's going to help.
Yeah.
Probably not much.
And that we hear that specifically in connection with scaly, rashy skin of the lower leg. That that feeling of tightness. So like their skin's going to break apart.
And doesn't it actually do that sometimes?
It can break.
It can break.
Sure.
And this is why we talked about in many, many shows in the past, spontaneous bleeding. Sometimes it's there, and it takes just some little thing, and all of a sudden your leg's bleeding. You don't know why. You didn't hit it. You didn't bang it. You didn't poke it. It's bleeding.
Yeah. Or when the patient has that condition, a very minor bump on a coffee table or whatever may create a bad break in the skin, which may very well turn into a non-healing ulcer.
We've had a couple of patients in, and one of them that comes to mind was a guy named Warren, and Warren presented. And he was talking about how his legs oozed, and just saying that is like oozed. What is that?
Well, that's an advanced state of swelling, and the skin is abnormal to the point where
it's just not holding stuff in.
Yeah,
right?
Exactly. Yeah. Skin is meant to either hold things out or hold things in, and if the skin is abnormal and in venous disease, what happens is the pressure inside the venous system gets real high. Something we call venous hypertension, and that's causing fluid and other blood components to leak out into the fatty tissue and into the skin, and it just kind of comes out. Yeah.
And if that's happening to you, this is a clear sign to me. I don't want to necessarily ring an emergency bell, but it's pretty close to it. I mean, that's not, quote, normal, is it?
It is not normal.
Yeah. I mean, you might think, well, this is sweat. It's not.
No.
I mean, isn't there a discernible difference here?
Yeah. I mean, I think Warren told us that, over the course of a working day, he had to change his socks several times. Because of the amount of fluid coming out. So that is not a normal situation, and definitely needs to be looked into. He was doing that, of course.
And he would, this guy, and if you've ever heard that show, and I'm sure you will, takes a real proactive role in his own treatment and knowing when to stay away from things. And I'm certain that sometimes during your chats with patients that you give them suggestions about things that maybe they shouldn't keep doing if they want to work with you to kind of help them. There would be some things that would be not good for you.
Right. Yeah. There are some home remedies that should not be done. Well, not so home remedies like steroid creams and all that sort of thing. But we try to recommend strongly how we feel people should be handling things. And most of the time, even if it is a home remedy, most of the time it's not deleterious.
Let's talk for a minute, if you don't mind, about some symptoms that may present when their problem is way inside, not visible at all. We talked about some of these things already, like the heaviness and the swelling and all that. I'm not talking about the skin. I'm talking about somebody that's got venous insufficiency in their big veins way inside their legs.
Yeah. There's two systems of veins, the superficial system and the deep system. Are you talking about
I'm thinking
the difference there?
Yeah,
or?
Yeah, I'm talking, well, most of the time, varicose veins.
Yeah.
On the outside, the easiest ones. That doesn't necessarily mean that your whole leg going all the way inside to that deep one does. But when it does happen in their deep, how do you find out about it? How do you even know that it's going on?
Yeah.
What are those symptoms?
Well, those symptoms, the symptoms of deep venous insufficiency, and we see, a fair number of people with that also. Luckily, most people, there's two systems, superficial and deep. Superficial system is the system that we can work with quite a bit more than the deep system.
Okay.
And that's good because most people primarily have superficial venous insufficiency. However, many people have both. What are the symptoms of deep venous insufficiency?
Yeah.
Similar. Mm-hmm. Similar to what we see in superficial. Swelling can be a big component, and something that we haven't touched on yet, but hyperpigmentation. A brownish discoloration of the lower leg is a little more commonly seen with deep venous reflux. But how do we figure it out? Well, we figure it out the same way we do superficial problems, and that's with an ultrasound.
One of the things that I think is fascinating when people find out that deep system, just how big those veins are.
Those are big veins.
They're pretty veins. They're pretty large, aren't they? Yeah.
They are big. Yeah.
Yeah, and are they treated in the same fashion? I mean, it must be a lot more difficult to get in to treat a deep vein problem.
It is. It's not quite so straightforward. And usually it requires some sort of surgical intervention. Mm-hmm. At least, at this moment, it's a surgical kind of problem primarily. And unfortunately, the procedures that we have for repair of deep vein valves are okay, but they're not. They're fallible. They don't last a long time, and there can be complications.
It seems though that it is less likely, even though a large percentage of the population does have venous insufficiency, that a lot of those people don't necessarily have deep vein problems.
No, most of them don't.
Yeah, that's pretty good news.
So that's good.
Okay, so the symptoms that we've been talking about, if you want to recap in the couple of minutes we have left, they all pile up.
Yeah.
I mean, it can be swelling, it can be itching, it can be
rash.
It can be a heaviness. It can be a lot of things.
Restless leg.
Yeah.
Cramping. And then the other thing, just quickly, because a lot of people don't know this, the brownish discoloration of the lower leg is something that all the time gets attributed to other disease processes, diabetes often. Yeah. And, often it's due to venous insufficiency. And if you see that, you probably need to have that looked into and ruled out.
I think it's sort of interesting. And since I've been doing the show and stuff, and also since I've been a patient, I kind of noticed that a little bit more, and I'm sure that you, as a doctor,
all the time,
you must want to walk up to somebody. Hey, listen, man, I'm not looking for business, but you got to get that looked at.
Yeah,
that's kind of isn't that sort of a hard subject to brace, even with families?
Yeah, it's always a little uncomfortable when you feel compelled to, talk to somebody who you don't even know, but feel like, gee, they must be suffering so much. I don't do it very often, but I have on a few occasions, and it worked out okay. You don't want to be too intrusive.
Yeah, and I want to tell you something. The more you bring to the party, the quicker you can get some help. And if you're the least bit interested right now, you need to go to veinclinicsofhawaii.com and check it out. veinclinicsofhawaii.com. On Maui, on the Big Island, on Kauai, and here on Oahu. The staff is terrific. Dr. Juleff has got a great experience for you, and all you got to do is come and check it out. And tell your friends about the program. And particularly, I know a lot of you, I don't want to say you need to do an intervention, but you maybe should say, I heard this on the radio, and this kind of might be you. You might want to have this taken a look at. So remember that. And then come back. We'll see you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.